Hi, I just wanted to take a few moments to talk to you about proper aftercare. Proper aftercare is the most important thing that you can do to make sure that you get the best results possible from your surgery. Now, I'm going to go over a few different things that are very important. A lot of this has been in the written information that we provide to you, but I'm going to go over it here in this video so that you can refer back to it as you need to. Now, the most important thing in terms of aftercare, and I stress this all the time, is make sure that you share all the information, written and verbal, that I and my staff give to you before the surgery. Share that with the person that's going to be taking care of you that evening. This is critically important because that person needs to know exactly what's going on so they can take good care of you and keep you safe. Now, after we finish your procedure, you're going to be wearing a garment. The compression garment helps to mold and shape your body while the healing process begins. The other thing that the compression garment is going to do is going to squeeze out any excess anesthetic fluid that's left behind underneath the skin in the areas that we worked on. Now, this can be a little messy. That's why I asked you to stay close to home for the first couple of days. The drainage usually stops after about 48 hours. But literally, you will be able to physically do anything you want or need to do, even going back to work the very next day after surgery, the way that I do it. Now, if that's something that you have an interest in doing, let us know. We'll talk to you about how to take care of the drainage so you can go back to work at the hospital. If you're a lawyer, go back to court or whatever the very, very next day. Now, remember that we talked about the garment. The garment's going to be critically important. You need to keep the garment on exactly the way we put it on your body for 48 hours. Before taking it off, before showering, before doing anything else, make sure that you keep that garment on exactly the way we put it on your body for 48 hours. Now, during that time, if you have any drainage that's coming through the garment, you can take care of that by cleaning outside of the garment with a washcloth and hydrogen peroxide, and then you can scrub it and clean the areas because the drainage is going to be blood tinged, it's going to be bloody, and that way you can keep the outside of the garment clean. After you clean it with hydrogen peroxide, simply take a paper towel and dab it over the area that you cleaned where the drainage was coming from and throw away the paper towel. You'll be doing that for the first 48 hours. After the first 48 hours, you'll be able to take your first shower. What most patients do is they will take some liquid soap, either dishwashing detergent or liquid detergent, and take it with them to the shower. Before you go to the shower, take your pain pills. And by those pain pills, it's typically the 2 Aleve and the 2 extra strength Tylenol. You take those 4 pills about 30 minutes before you take your shower. By the time you get out of the shower and you start doing your massage, which we'll discuss also, you will be very, very comfortable, and it won't be so uncomfortable doing the massage that's required and necessary, okay? Now, you're taking your pain medicine, now you're going into the shower with liquid soap or liquid detergent. Take a garment off, wash the garment really good with liquid soap or liquid detergent after you take it off. Then after you finish with the garment, take the garment, ball it up, and squeeze the excess moisture out of the garment. Squeeze the excess moisture out of the garment, take your garment and put it up over the shower door or over the shower rod. Then you finish taking your shower. If you had the tummy done, the abdomen, most likely you're going to have a piece of foam like this over the abdomen. This foam is stuck to the skin. Do not remove the foam. This is very, very important. This foam helps protect the healing skin underneath, and it helps to keep that as flat and as smooth as possible during the early part of the healing period. After you take your shower, and it's okay to let water run over this foam, take your towel, dry yourself off, and then you can dry off the foam by taking a towel, like right here, and then rolling the towel up like this into the shape of a giant rolling pin, like this. And then take the towel and you can squeeze it and roll it over the foam to take the excess moisture out of the foam. as part of drying yourself off when you come out of the shower. Okay? So we're taking care of the foam is stuck on your belly. Now, you can finish drying the foam using a blow dryer on the low heat or no heat setting. Do not use heat because then the glue is going to come off and the foam is going to come off of your skin. You do not want that to happen. So use a blow dryer in the low heat setting. You can finish drying the foam off in takes about 1 minute. Okay? Now, you've dried yourself off, you've dried off the foam, and you've got that garment that's damp, that's hanging over the shower curtain rod. Now, you take another towel, you spread the towel out. You may need to do this on your bed so that you have enough space. You take the damp garment, you lay it on the towel like so, okay? Once you've laid the garment on the towel, then take the towel and roll up the garment like a big giant sushi roll. Roll it up like this, okay? Now that the garment is all rolled up, now you can wring this and wring it as much as you can, as hard as you can, without overstretching and without damaging the garment. So you stretch it and squeeze and squeeze and squeeze as hard as you can. And now that takes the excess moisture out of the garment. You can take the garment and you can finish drying it with the blow dryer on a low heat setting, just like we did with the foam that was on the tummy. Or you can take the garment, put it in your dryer at home on the lowest heat or no heat setting. It'll take about 20 minutes to do it that way versus about 3 minutes if you use your blow dryer with the garment, hanging up on a hanger or someplace where you can get to all parts of it, okay? Now, let's suppose you take the garment and you put it in your dryer. Now what do you do during the 20 minutes while the garment is drying? That's when you do your massage. Get your favorite lotion, baby oil, whatever you like, and then rub and massage all the areas where work was done that is not covered by the foam. This is critically important because this is going to help any trapped fluid that's underneath the skin where the fat used to be. It'll help get that fluid out so that it doesn't remain trapped underneath the skin where the fat used to live. That could cause a complication called a seroma if it's serous fluid, or a hematoma if it's bloody fluid. We don't want that. That's why the incisions are left open so that garment can squeeze out any remaining fluid underneath the skin during the first 24 to 48 hours. Now, this routine that I've described to you is going to be your daily routine until you come back to see me in the office about a week or so after your surgery. At that time, we'll remove the garment from your tummy if you had it done to that area. If you've had other areas like the arm done or underneath the chin or the neck, then don't worry about it. There's no foam in those areas, but you still have to do the massage after you get out of the shower. That'll be your daily routine. Take your 4 pills, 2 Aleve and 2 extra strength Tylenol about 30 minutes before you get into the shower. Take your shower, come out, and then do the massage before you put your garment back on, okay? So if you have any questions about any of the instructions that I've given you, please call the office, 713-523-2500, and we'll be very happy to help you. We're dedicated to getting the best results for you. We need your help. It's a partnership between us. Help us help you look your best self.